Members of the governor's opioid task force met this morning to give updates on the progress that they've made over the past few months. Chris Buckley joins us live from the newsroom. And Chris, this task force is one of the governor's top priorities.
It is, and this is the third time they've met, kind of a turning point from talking about what they're going to do to being able to actually discuss some results, like a new report from the pharmacy board.
From looking at the prescription drug monitoring program, that's a database of all the prescriptions that are prescribed, issued in Nevada, and we got a report today that basically said that they've seen opioid prescribing reduce about 31%.
Different committees talked about the steps they've taken in the past months regarding prevention efforts, education, treatment options, and intelligence sharing. There's been a push to keep these kinds of drugs off the streets, take-back days, and different disposal programs. While committee members say they're seeing some positive progress, they still have a lot of work to do.
Working with the medical community and really helping them to better understand what the evidence is telling us related to alternatives to opioids for pain management is a big strategy, as well as ensuring adequate access to treatment for individuals who have addiction disorders, not just opioid use disorders, but addiction in general.
Now, during public comment, an issue that was raised several times is the possibility the pendulum has swung just a bit too far for chronic pain sufferers that rely on these kinds of drugs to function in daily life. It's something those on the task force say they take very seriously, that those kinds of cases should be addressed on an individual basis so people that need these drugs have access to them and doctors can feel comfortable prescribing them. Covering the story live in the newsroom, Chris Buckley, Channel 2 News.